It's one of the fastest ways to get back to our normal lives, return to those enjoyable moments that matter the most. Ones like spending time with your family on vacation. I know many of you, like myself, I am ready for a real vacation. No more staycations this year, right? And then there's being able to see your family. If you have elderly parents like myself, being able to hug them in person and not do the drive-by parties anymore. So we're trying to get back to normal. So today I'll share the latest news and updates on the vaccines, including information about their safety, effectiveness, and availability. I'll also discuss ways that we can protect our health as we wait for our turn to be vaccinated. I know some of us, maybe those younger folks on the line, that your turn hasn't come up yet, but it'll be here soon. At the end of the presentation, I'll also answer to the best of my ability your questions. So on the next slide, we'll talk about the updates on coronavirus. And let's think about it. It has been, I'm looking at the date, March 26th. It's been a little bit over a year since the pandemic restrictions started in the United States due to the SARS-CoV-2 novel coronavirus. Now, COVID-19, it is a viral respiratory illness that is caused by the SARS-CoV-2 coronavirus. The virus itself, it is a member of a family of viruses called coronaviruses. You've probably heard it before, seen it on the Lysol containers. Coronaviruses, they have been here, but this particular one has been quite severe, one of the most severe coronaviruses. And this virus is spread through the air, and these aerosol droplets hang in the air for a period of time and infect those that come into contact. It has no known cure, but we do have a vaccination now. So I just wanted to share, as most viruses do, the virus constantly changes through mutations, and that's what we're showing on the slide here. There are some new variants of the virus that occur over time, and sometimes the new variants, they may come and appear, and sometimes they disappear, and at other times they persist. So we're concerned about the ones that persist. And there are multiple variants of this virus of COVID-19 that have been documented in the US and globally. So one of our biggest concerns now are the new variants. I've listed a few on the slides. As you can see, there's a variant coming out of the United Kingdom that was first reported in the US around December. There's one coming from South Africa. And actually, there's different mutations that are coming, and these variants have been detected in multiple countries outside of South Africa. And this one from South Africa is one of the ones that they are um, thinking is more of a more deadlier variant of the COVID virus. So we need to make sure that we are staying abreast of these variants. And then there's one in Brazil that's out, and it has different mutations. And that was both the South African and the Brazil variants. They came up, we've seen it in the US in around January of 2021. So it is very important that we all do our part in slowing the transmission of this disease through vaccinations. And I wanted to share, just to give you a big picture of how COVID has impacted the world. Based off of the World Health Organization, which is known as the WHO, as of yesterday, March 25th, the global numbers total cases of COVID is 124,535,520 confirmed cases globally. And that has also close to 2.8 million deaths. So this is really a bad situation going on here. And when we talk about just in the United States, in the CDC is reporting that we have about 29 million cases here in the United States and about 500, and it's more than that. It states 525,000. I checked yesterday, we're at 542,000 deaths in the United States. So we really have a lot of work to do through vaccinations. The total vaccines administered is about 133 million. So to put this in perspective, I don't know if you've been listening to President Biden's speeches. His administration, they've actually made a deal with Pfizer and Moderna, which are the two main vaccinations manufacturers out right now. President Biden's administration has agreed to distribute 600 million doses of the vaccine. So that equates to about 300 million Americans being vaccinated. That is their goal. And we're at about 133 million now, so we almost are half there. And then when we talk about Florida, we know it's spring break time. You've probably seen it on the news in Miami. There's a lot of the younger folks out having a good time on spring break and being a little bit careless when it comes to protecting themselves, wearing the proper protective equipment, a mask, a lot of out. But in Florida, we have a total number of confirmed cases of close to 2 million people. And our death rate is about 32,000, close to 33,000 deaths in the state of Florida. And when you look and put it a little bit more in perspective, when you break out these numbers, the highest confirmed number of cases are in the age group of 25 to 34. And there's about 345 confirmed cases in that age range. And then when you look at the age range of 35 to 44, there are about 308,000 cases. And then when you look at the age range of 15 to 24, there are 306,000 cases. But what I wanted to share, because when I broke down the numbers, I was like, wow, it's the younger generations that are getting the cases, but the death rate is highest amongst those 65 years and older. So our elderly population, although the younger generations are the ones who are actually having the highest number of confirmed cases, is most deadliest in the elderly population. One of the things we also do is look at the positivity rate. So, and it actually is going down. That's the number of cases that are reported positive on a daily basis. So, around when this presentation was first put together, the positivity rate was about 6.9%, and this was on March 9th. But as of yesterday, it's down, the positivity rate is about 5.6%. So we are trending downward. This gives us an idea of the amount of disease that are actually in our communities, and we want it to be under a 10% positivity rate. And some people want it to be less than 5. So we're trending downward, and that's always a good sign. So on the next slide, I will share information on the vaccine development. I know this has been a big concern to many. How were we able to get a vaccine so quickly? But we are living through a historic time right now. The COVID-19 pandemic, it's most often compared to the H1N8 influenza. You remember the Spanish flu pandemic in 1918. Although there have been 3 other major pandemics since then, of note, this one is one of the most biggest pandemics, because in the 20th and 21st centuries, those pandemics, they all were also caused by a coronavirus or influenza virus. But in terms of the number of deaths COVID-19 has caused, we are definitely living through a historic time as it relates to scientific history as well. With this COVID-19 vaccine, This is the fastest scientists have ever developed a vaccine. In the past, it has taken years to develop vaccines. However, new research and technological advances, they have allowed the COVID-19 vaccines to be created faster than ever before. So this is good news. And many wonder, how was this vaccine developed so fast? So I wanted to share a little bit about how it happened. First, our researchers, they have to determine the genetic sequence of a virus. So historically, it would take years to uncover the genetic sequence of a virus and to develop that molecule in a vaccine that gives us protection. But thanks to scientific improvements, researchers quickly cracked COVID-19's genetic code. So, partly due to similarities to other viruses that we've seen in humans, such as the MERS or the SARS virus, those viruses, we've had quite a bit of time to research those. And that usually takes the longest part of the vaccine making process which is uncovering that genetic sequence of a virus. So we kind of had that information already. Then once we determine the genetic sequence or that code, that material, a vaccine can be developed using different strategies. I'm going to talk about the strategies in the next slide, but right now I'm going to stick to this slide and talk about the vaccine types. Because once the vaccine types are identified, then the vaccines are tested in clinical trials. And then after clinical trials, the vaccine, this particular vaccine was developed so quickly due to some of the red tape being removed to bring the vaccine to market. For example, historically, it takes about 10 years or up to 10 years for the FDA, which is the Food and Drug Administration, to approve a new medicine or a vaccine. But in a state of emergency, such as what's going on now with COVID-19, the FDA can grant an emergency use authorization, which provides more quick or timely access to these vaccines. Because the COVID-19 clinical trials, they were great. They showed such strong efficacy and safety. So the FDA issued an emergency use authorization to approve the COVID-19 vaccine. And as you recall, taking a look back at the timeline, we started seeing COVID in December 2019, January 2020. By December 11th, 2020, the FDA issued the first emergency use authorization to Pfizer for their vaccine, and that is available for individuals ages 16 and up. And then a week later, here we are working quickly. Another manufacturer, Moderna, they received their FDA approval for emergency use authorization, and their vaccine is for individuals 18 years and older. And then fast forward to last month, about a month ago, we actually now have a third vaccine that's available through Johnson and Johnson. And this one is for use in individuals 18 years of age and older. You are probably also hearing information about a new vaccine because they're testing going on right now as we speak, and some are still being worked out, coming down the pipeline. You probably hear about AstraZeneca. They have a vaccine that's been developed. In February, it received the emergency use listing designation from the World Health Organization, but it started distribution in other countries, but it has not been approved in the United States yet. So they're still working out some things with that vaccination. So all of this is very exciting news in regards to vaccine development. Again, vaccine have historically required years of research and testing, but scientists have been working on vaccines for decades, and in this technology that we have, it efficiently produced a safe and effective coronavirus vaccine this year. So on the next slide, let's talk a little bit more about these types of vaccines and what they're actually doing in our bodies. So I will try my best to explain. I am a pharmacist, so I'm going to try to talk to you in layman's terms to the best of my ability so I can help you understand what it means to have different types of vaccines. So in this slide, what I've done here, or what we've done, we've used these different color arrows to show each vaccine type. Then illustrated in the center, you'll see that little injection there. That happens is showing what happens after you receive the injection. So what's happening in your body. And then the next arrow leads to the correlating response, what we're looking for, that immune response. For example, let's follow the blue arrows with the mRNA. You've all heard about it. Messenger RNA. You will see the mRNA vaccine types, which are the ones we have with Pfizer and Moderna vaccines. So the blue arrow demonstrates that this is a proteins. Oh, and I'm sorry. There's also the protein subunit type vaccine. We don't have any of those out right now. They are being studied, but they follow the same pathway. So after a dose is injected of the mRNA vaccine, so your Pfizer and Moderna vaccines, they produce a viral protein which starts an immune response. So I'll talk a little bit more in a few minutes about what that looks like. Then we have other types of vaccines. Moving to the next vaccine type, two lines down, that goldish color are the viral vector vaccines. So this is where you will find your Johnson and Johnson or your AstraZeneca vaccines. These are your viral vector types. These are non-replicating. What happens is they have instructions to make antigen-presenting cells to produce an immune response. So this type of vaccine currently is used in our Ebola vaccines, and sometimes in veterinary science, they have medication that follows the same viral vector pathway. Looking down, the live attenuated vaccines. You probably heard that before. These are the ones where the virus causes the virus to replicate and produce an immune response. For example, right now, our measles, mumps, and rubella, those shots, the MMR, chickenpox vaccine, the rotavirus virus, they all use this type of live attenuated vaccine. And then last, that purple line, it's where we're talking about the inactivated vaccines where we need an adjuvant to work to produce the immune response. Some of your typical inactivated vaccines are your flu shots, the polio shots, rabies shots. These all have those inactivated vaccine types. So again, once these actions start working, there's a coronavirus. You hear about this spike peptide. This spike, that's how the virus mounts to your cells. They mount, and an immune response is produced, which produces antibodies. So to give a little bit more context on how these vaccines work, for example, with the mRNA vaccine, the Moderna and Pfizer, these are made from a genetic molecule called messenger RNA. So the mRNA vaccines, they carry strands of mRNA that in the body function like an instruction manual. So the mRNA, they contain genetic instructions for the cell on how to make a piece of that spike protein that you see on the SARS-CoV-2 virus. So that spike protein, you probably see it, it kind of looks like a little crown, the little spike that sticks off of the virus. It's the perfect substance for your body to recognize as foreign and start to develop antibodies. Because the mRNA encodes only just for that spike protein itself, by itself, the spike protein is harmless. It's a harmless protein found on the surface of the actual virus. It does not do any harm to the person vaccinated, and the vaccine cannot cause COVID 19 infection. However, what it does, it provokes an immune response in the body that helps create the antibodies necessary to fight COVID 19 effectively. So once the spike protein is created in the body using the mRNA, the instruction manual, the body cells uses enzymes to quickly break down that mRNA strand for removal by your normal cellular process. The mRNA, it doesn't actually enter the nucleus of any cell. So in the nucleus of your cell is where your DNA is located. So mRNA, it is not getting into your DNA. So it's definitely not affecting your genetic material in your body. That's kind of like a common myth. A lot of times people are kind of scared about the mRNA process because it seems alarming for us to hear how the mRNA enters into your cells to create a response. But this is exactly how viruses work when they get into your body. When you get a virus, it gets in your body, it comes in contact with a host cell, then a virus inserts its genetic material into your host cells and take over the cell's functions. And then you have in cells infected by a virus, which produce more viral proteins and genetic materials instead of the usual products in your cells. So don't be afraid when you hear the mRNA vaccine, because hear about it, because it uses the same technology to prevent infections and or reduce disease. Okay. So again, I repeat, it is important to note that the mRNA strand never enters the cell's nucleus where your DNA is located. And so it does not even affect your genetic material. After receiving that mRNA vaccine, our body will produce a recognized spike protein that should not be there, and it builds antibodies that mount an immune response. So if we're ever infected in the future, those memory cells will recognize and fight that virus off. So for the viral vector vaccines, that's the Johnson and Johnson that's currently out. What you're seeing there is a weakened or a killed version of a live adenovirus that has been inactivated. So what happens is the COVID-19 viral vector vaccines inject a harmless adenovirus vector which carries unique genetic information from the COVID-19 virus. So here again, it introduces a small piece of that spike protein for your body to recognize it, and then it develops antibodies. So the antibodies created are specified to the virus, specific to the virus that causes COVID-19. So then your body is prepared to protect against any future infections of that SARS CoV 2 virus. I know that was a lot. I try to do my best to explain what that virus looks like and what's actually happening in your body. One of the things to note, and you probably also heard it, both the Moderna and Pfizer vaccines, they're kept at very, very cold temperature and require 2 doses. So with Pfizer, what they've done with their vaccine, once it's taken out of the dry ice, it must be kept in the refrigerator for 5 days. The reason it must be kept at such a low temperature is that there are no preservatives. So for the next manufacturing phase, what Pfizer plans to do is what they call lyophilize, which is freeze dry the vaccine to turn it into a powder so it won't just need to be refrigerated. Again, the Pfizer vaccine is for those ages 16 and up, and Moderna is for 18 and adult 18 and up. And both of those vaccines require 2 doses a few weeks apart. So 21 days for Pfizer, 28 days for Moderna. And then AstraZeneca or the Johnson and Johnson vaccines, those are those adenovirus vector vaccines. They are about 70% effective. But one problem we've seen with these types of vaccines is people already have immunity to some of those adenoviruses. But however, the scientific evidence from the Johnson & Johnson vaccine demonstrated that the vaccine was actually 85% effective in preventing severe disease across all those studied. So, beginning 28 days after vaccination, we've shown studies has shown that it protects against COVID-19 related hospitalizations and death. So that is in a nutshell the different types of vaccines. And on the next slide, I will talk to you more about the safety of them. And I see some questions coming in, and we'll address those at the end of the presentation. So Steve, I'll be right back to your question really soon. So safety is a top
Gonna stay with this
priority.
one.
Vaccines are developed using strict guidelines from the FDA and they're thoroughly reviewed by the FDA. So, one of the things we want you to know that there are different systems that the CDC and the FDA use to continue to monitor the safety data of these vaccines. The different safety tools are listed on the slide. We have the Vaccine Adverse Event Reporting System. This is something that the CDC and FDA has available for general public use. This system collects and reports from healthcare professionals, from the manufacturers, and from the public any type of adverse events that happen after the vaccination. So the reports of these adverse events, we are looking for the ones that are unexpected, and they also show the ones that appear to happen more often than expected or have unusual patterns. And then once we receive this information, they're followed up on with specific studies. So that is the Vaccine Adverse Event Reporting System that the general public has access to. And then the CDC has the Vaccine Safety Data Link. What this is a network of 9 integrated healthcare organizations across the United States that conducts active surveillance and research. So, this system is also used to help determine whether possible side effects identified using VAERS are actually related to the vaccine. So, the Vaccine Safety Data Link, again, is a network of organizations integrated to um, active for active surveillance of the vaccines. Then there's the Clinical Immunization Safety Assessment. This is a collaboration between the CDC and 7 medical research centers, which provide expert consultation on individual cases. And they also conduct clinical research studies about vaccine safety. Then there's BEST, which is Biologics Effectiveness and Safety System. And what this is a system of electronic health records, administrative and claims based data that we use for active for surveillance and research. So if you, and then the last one is vSafe. If you have already received your vaccine, you should have received information on the CDC's vSafe app. What the vSafe is, it's a new smartphone based app. So after the vaccination health checker, for it checks people for COVID-19 vaccine related issues. So what vSafe does is they use text messagings and web surveys from the CDC to check in with the vaccine recipients for health problems following your vaccination. So the system will also provide telephone follow-ups too to anyone who reports medically significant adverse events. There are so many more safety monitoring systems. Please note that our federal government, the CDC, the FDA, they take safety as a top priority. So we are continuously monitoring this vaccine day by day. On the next slide, we're going to talk a little bit about who can get vaccinated. And there was news that came out yesterday, actually, So this slide has actually changed. So, this is a fluid situation here with COVID, and things change day by day. So when we first created this presentation, this was the list of people who could actually were eligible to receive the COVID-19 vaccine in Florida. Different states have a slightly different criteria, but this was what was our eligibility criteria in Florida. We still are offering first priority to long term care facility residents and staff. Now, as of I believe yesterday, I think it was March 22nd, actually, we started allowing persons 50 years of age and older to get the vaccine. Of course, anyone under the age of 65. So anyone actually who is deemed medically vulnerable by a physician, they were eligible to get the vaccine. And what they mean by medically vulnerable means having pre-existing conditions that make them more susceptible to the COVID-19 vaccine virus, not vaccine virus. And of course, healthcare personnel with direct patient contact always have had priority. And we also gave priority to those K through 12 school employees and law enforcement officers and those first responders like the firefighters. But new breaking news on Monday, Florida, Governor DeSantis has lowered the age to 40. So anyone above the age of 40 can now will be allowed to get vaccinating starting on Monday. And then a week later, any resident age 18 and older will be allowed to get the vaccination as well. So again, the different states can determine whether to follow the federal recommendations or not, but the goal is for everyone to be able to easily get a COVID-19 vaccination as soon as possible or as soon as we have enough vaccination available. So on the next slide, I'm going to go into some of the myths and some of the facts because there's a lot of things that we are hearing about, I'm thinking about getting the vaccination, but I'm not sure. I know you heard me earlier talk about DNA. People think that it will change their DNA. No, and I've said it earlier in the presentation, this is not going into your nucleus, your cell's nucleus, so it's not going to impact your DNA. Changing DNA is not a risk that we run with this mRNA technology. So this is one of the vaccine myths, because people think you will alter your DNA because it's genetic material being injected into your body. But the good news is that it doesn't do this. mRNA is naturally made by the body, usually in the nucleus of the cell, and then released in the main part of the cell. Then it encodes instructions for your bodies to make that spike protein. And so, for this purposes, the mRNA vaccine is relatively safe. What it's doing is teaching and training your body to make an immune response to that foreign pathogen, that spike protein. So, if that pathogen ever gets into your body again, your immune system will attack it. And then there is in thoughts that, oh, well, if I get the vaccine, I'm going to get COVID. That is not the case as well. None of the authorized COVID-19 vaccines or the ones currently in development in the United States, none of them contain the live virus that causes COVID-19. So this means that a COVID-19 vaccine cannot make you sick with COVID. Again, there are several vaccines in development. All of them are teaching our immune systems how to recognize and fight the virus that causes COVID-19. So sometimes this process can cause symptoms such as like a fever or some other symptoms that some people may think that they have COVID. But this is just a normal sign that your body is building protection against the virus that causes COVID-19. One of the things I did want to share as well, there's some information that's saying that if you have severe allergic reactions, that you should not get the vaccine. So really, if you have had severe allergic reactions, those are the people that experience anaphylactic shock with certain medications or those who carry an EpiPen. You want to consult with your doctor about getting the vaccine, because if you've had a severe allergic reaction, um, well, in addition, if you've taken the vaccine and you've had a severe allergic reaction to the first shot, the CDC does recommend that you do not get the second dose, because if you had a reaction to the first dose, you definitely don't want to get the second dose. But for those people who've had severe allergic reactions for other medications, such as medications that have been given by IV infused medications, like iron infusions or chemo, if you have a history of having a severe allergy to those infused medications, you are at an increased risk of having a similar allergy with the Pfizer vaccine. But it is very rare, and it is not a reason to that we recommend to not get the vaccine. But what we do recommend that if you have a history of having allergies, um, allergies, can be managed. So we ask that if you get a COVID-19 vaccine and you have a history of those severe anaphylactic reactions, that you do your vaccines in a clinical or hospital setting, so that in the event of a reaction, you can be immediately responded to. Also, for people like myself who have allergies to other medications, what they do once you get the COVID vaccine is just have you observe for a little bit more, for about like 15 minutes more after you receive your vaccine, to make sure that you don't experience any adverse effects. So allergic reactions, again, does not necessitate you can still get the vaccine if you have a history of allergic reactions. Um, the vaccine is definitely not for use in those under age 16. There are studies currently underway in both Pfizer and Moderna. They've actually enrolled children in their clinical trials. So hopefully by late fall, we'll be able to vaccinate our school age children. So again, right now it is true that the vaccines are not for use under the age of 16. For those who are pregnant, ladies, part of people who are pregnant and part of a group recommended to receive the COVID-19 vaccine may choose to be vaccinated. There is currently no evidence that antibodies formed for COVID-19 vaccination cause any problems with pregnancy, including it doesn't impact the development of the placenta. So if you're trying to become pregnant now or at a future time, there is no evidence that fertility problems are a side effect of any of these vaccines. If you have questions about getting vaccinated, please check in with your doctor, especially if you're pregnant, okay? And then if you have had COVID-19, yes, you still should be vaccinated. So if you know I'm sorry, if you have already been vaccinated, we want to make sure that you wait at least 90 days before getting the COVID-19 vaccine, because you already have natural antibodies during that first 90 days. So we want you to wait till after 90 days if you've already had the COVID-19 vaccine. COVID-19, if you already had it, wait 90 days before you get the vaccine. So talk to your doctor if you're unsure what treatments you've used, if you received any treatments, if you were hospitalized for COVID-19, because if you receive certain treatments, you may also need to wait before you get the vaccine as well. So another question we have people ask is, how long will the vaccine last? We know it lasts longer than 3 months, and researchers predict that it could last as long as 15 months. So we do expect routine, regular annual vaccines, but this information is currently being studied, the exact duration or the exact length of time this vaccine lasts. Moving towards the next slide, just giving some general information on Florida COVID-19 vaccination, a summary of the dosings that have been administered in the state of Florida. And this data is from March 8th, so we should be higher now. So as of March 8th, we had close to 4 million people receive at least the first dose, and that is 21% of the Florida population age 16 and above. To date, there is about 2 million, so 1.97 million have received the complete series. And Florida has administered approximately 71% of its allotted doses. So we're making good as what you hear coming down the pipeline with more people being allowed to be vaccinated. These numbers will go up. Next slide. We kind of already talked about when you can be vaccinated. It's based on your age and risk factors. Pfizer, Moderna, we need to remember that there is a second dose. Johnson and Johnson vaccine, we do have those available in Florida. If you really want to know where and when you can be vaccinated, you can go to the Florida Department of Health website or contact your county health department or text Florida FLCOVID 19 to 88887 for updates. Because the U.S. supply of COVID-19 vaccine it was originally expected to be limited. The CDC provided those recommendations that the federal, state, and local governments adjusted. So as you heard me say earlier, we are allowing more and more people to get the vaccine started this week, and it will continue over the weeks to come. So if you fall into one of the categories, you should immediately contact your health department. You can even go online. I did it. It was really quick and simple. You can play around with your locations. The website that the state of Florida refers you to, you can check if you want to go to in Hernando County, Pinellas County, Hillsborough County. It's very, very simple. When I did it, I tried to pick the first available appointment. I didn't want to wait. So I actually traveled to Hernando County to get my vaccination. And it was an absolutely great process. I was totally impressed because I see the lines around town here in Pinellas County. I'm in St. Petersburg, and I see those long lines of people waiting to get their vaccinations. But I was impressed when I went to Hernando County. It was at the fairgrounds, and it was like a drive-through vaccination shot. I couldn't believe it. I drove up, told them my name and birth date. It was an app on the phone that showed my appointment, and they scanned the app, and they shot me within a matter of minutes. So I was technically in and out, but because I have a sulfur allergy, I had to wait a little bit longer. So I mean, it was actually worth the drive. I mean, I didn't have to get out my car and stand in long lines. It was great. So if anybody want to have a quick and fast shot, I recommend going to Hernando County. It was really quick and easy. But again, there are different ways you can get the vaccine. There are different places. Um, there, and of course, there are different brands. One of the things I do want you all to realize is depending on your location you go to, you cannot particularly say, I want the Moderna brand or I want the Johnson and Johnson. Different locations have different brands available. So you get what they have available. So That is one thing you need to know. If you really want a particular brand, you may need to do some research on the locations to see what brands they have at those locations. I know that they said Johnson and Johnson, which is that one dose vaccine, has been shipped to Florida, and I believe Publix has them, and James A. Haley Veterans Hospital, they have that vaccine. And also, one thing to remember, if I haven't said it already, whatever vaccine with the two-shot series, so the Moderna and Pfizer, whichever one you start with, you have to finish with. So if you start with Pfizer, you have to wait and get the Pfizer booster vaccination. The second dose for the Pfizer vaccine is 21 days after the first dose. And the second dose for the Moderna vaccine, it is 28 days after that first dose. I think I hear some questions coming in, but I know we're running out of time. So let me go to the next slide here. So really quickly, I'll go over what happens after you get the vaccine. So first, you let out a big emotional sigh of relief. I mean, it's a feeling that, it's a feeling of excitement and joy, of accomplishment that you've done your part. So emotionally, you're just excited that you did your part, your first step, on getting back to the way of the world. But actually, seriously, right after you're vaccinated, you may experience some side effects, very small side effects at first, to include injection site reactions such as soreness or redness or swelling. Some people may get a low grade fever or chills, headaches, muscle aches, and fatigue. These are normal signs that your vaccine is working. We want everyone to be properly informed ahead of time, especially in regards to understanding what these side effects look like, because when you go back for the second shot, we're hearing that the side effects are a little bit more, because what happened is the second dose is ensuring that your body produces a good response and produces a lot of antibodies. So here's an analogy. You and your friend, you're trying to move a large, heavy table, right? And you're wondering, why do I need that second dose of this Pfizer Moderna vaccine? Why do I need that booster? So if you think about you and your friend, you're trying to move a large, heavy table, and you and your friend, you lift, but you're only able to get the table halfway to its destination, right? But then again, here comes two more friends, that second dose. Two more friends, they come on and they help you put that table up very quickly, and you get right to your destination. We need that second booster shot to help get the desired amount of antibodies we want. So that second dose gives us that boost in our immune system. With that second dose, because you got more people coming along, that means you got more antibodies, and it's going to feel like, it may feel like you're getting sick, but usually these are just reactions that's showing that the vaccine is working. Some of these symptoms last about 48 hours to a week on average, but if anything experience more than that time, you want to report that to your doctor, and maybe they may need to address some things and report it to the safety systems that are in place. So remember, although you can have some side effects from the coronavirus vaccine, you can't get COVID-19 from the vaccine, okay? And then the next slide, as we I want to leave a few more questions. This is very important. Although, if you get vaccinated, we want everyone to keep your guard up and continue to practice the behaviors that keep you safe. Remember the 3 W's. Wear a mask. Face masks are recommended for those face-to-face interactions and where you can't social distance. And the next W, watch your distance. So everyone should still be maximizing those physical distance, avoid socializing in crowds, especially indoors. And also wash your hands. That's the third W. Wear a mask, watch your distance, wash your hands. Remember, for 20 seconds, and continue to carry the hand sanitizer for the times when soap and water is not available. We must continue to do these things. We cannot return to safely celebrating with our friends and family or our loved ones until COVID-19 is under control. And it's also essential for us to get everything under control so we can get our economy back on track. So the vaccine and continued vigilance are our best defense against COVID-19. And then on the next slide, I just wanted to share some quick updates about coverages. So with many health plans, we have seen because of COVID, people have been missing their doctor's appointments or canceling them, afraid to go out and delaying some care that they need. We really need everyone to make sure you check in. If you missed any of your appointments last year, check in with your doctors as soon as possible. Because if you have an ongoing health condition, we want to make sure your condition is being managed and that you can get the care and the medications you need. Many doctors' office, of course, many didn't stop, didn't close, they are open. So please schedule your annual wellness visits, any other screenings that are recommended annually. If you're nervous about going out, ask your doctor's office what additional procedures they have put in place to keep you safe. It is important that we stay up to date on, even with our children, their normal vaccinations. Make sure your children are up to date on their vaccinations as well. Publix, Walgreens, Walmart, Winn-Dixie, all of them offer vaccinations. They have the flu vaccine still and any other vaccinations for your age. So make sure you're continuing to get the care that you need. For our Florida Blue members, what we've done is provided some extra layers of security per se for your medications. We allow members to get early refills of a 30-day supply of their maintenance medications. We also encourage our members to use the 90-day home delivery mail service so you don't have to go out in public to pick up your medications. We've made some slight changes with our premiums. So if you're not a Florida Blue member, you may want to check with your insurance plans to see if they have any similar programs. As you all know, COVID-19 testing and treatment is available at no cost. So if you ever have to be treated for COVID, if you have a positive COVID-19 diagnosis, that is no cost. And the vaccine is no cost. So these are some of the things that we wanted to share. And if you're having emotional issues, we have a great partner in New Directions Behavioral Health. We have a COVID-19 hotline where you can talk to specially trained behavioral health counselors 24/7 at no cost. And this for anybody, if you're a Florida Blue member or not, we have this hotline available where you can talk to a counselor about any stress you may be feeling. The toll-free helpline number is 1-833-848-1762. These counselors that we have available, they are not able to assist with questions about COVID-19 testing or treatment. However, if you have any questions or issues that you wanted to share, any stress going on, please call that hotline.